I have to say, listening to you, Barbara, and then what Dr. Agha said about that you sit with the institution, medical institution, that actually brings fear, was almost based on fear, because it's all about protection, and protection can lead to the feelings of fear. It's all done from a good place, but as soon as we get the two together, we can actually calm that down a little bit, and then bring the healing section of, gentle birth, maybe through water, and then have the synergy to create a birth that's done through mom and not for mom. So I absolutely love that. The way that you put it. And Dr. Agha, I think it must be challenging to deal with both sides, right? But to see it connecting, to see the bridge, is really beautiful. And I think it's really something that we need and to encourage. And this is why we have the open
I always tell him,
talk.
and I tell people, it's really difficult to be great. To sit back and to give that space and to, challenge yourself to be better. It's really hard work. It's so hard. It's easier to jump in and just get it done and move on and follow the regulation, and everybody is happy except for the mom and the baby. But everybody else is happy. And then that's easy. But to do stuff like that's why I asked him earlier, are you tired? He goes, all the time. Of course, because it's exhausting to be great and to sit back and give moms this opportunity and to bridge that gap. So it is not easy. It's not easy work. And we have to commend you for that, because it really isn't easy work. And it takes a certain kind of person to sit back, become masterly inactive, but also be super active when necessary, and bringing the peace when it needs to happen.
Yeah, and full of awareness. Because I'm always telling doctors, know what normal looks like. Because if you look at everything as abnormal, you're never going to appreciate the normality of releasing the baby in the water.
Yeah.
Know what normal looks like. Know what normal sounds like. There was a hospital in Jerusalem that I visit frequently, and they started their water birth program in 2020, right at the height of COVID.
Yeah.
We had planned together the previous year, and they went ahead and started offering water birth. And to date, it's close to 2,000 babies have been born at that one hospital in the water. As a matter of fact, I've been hospitals all over Israel, but that hospital attends over 27,000 babies. That's Arabic, and that's also Israeli. In that one hospital, 27,000 babies a year, but yet they have one tub, and they offer water birth for the women who meet a very specific criteria. And this is how we can combine high tech and high touch, is that you have to have a normal pregnancy. You have to be in labor with a normal labor. And so that definition then carries that woman into the pool. And what the nurse midwife manager told me in July when I was there, she said, I want the midwives and doctors to go into that room and stay there while a woman's laboring in the water, because that's the only time that they see completely normal birth.
Oh, wow.
There's no interventions.
Yeah.
No. You still have your blood pressure taken, you still listen to the baby's heartbeat, but you're not offering narcotics or epidurals or drugs of any sort. And so it takes a very specific type of personality to be able to have masterly inactivity. But yet we don't see normal. We don't see normal in hospitals today around the world unless they have a history of midwifery, like Northern Europe, UK, and even that's slipping a bit. I tried to find a midwife who was experienced in normal birth in France. Just this last couple of weeks, I was searching for somebody doing a documentary. I can't find one. It's slipping back to over-medicalized because it's more convenient. Get them in, get them out. And that's what I grew up with, and that's why I went in this direction, because what I saw in my own birth in 1978, my daughter's, she's 47, it was a production.
Yeah.
And I wasn't consulted for any of it, none of it. And I'm screaming and saying, no, I don't want that, I don't want that. And tied down like a prisoner, tied to the bed.
Oh, wow.
And I said, this has to stop.
Yeah.
Okay. Well, we've gotten some things different, but the basis of it is still the same thinking, that this is under our control in the hospital, and you don't have a right to not follow our rules.
Yeah.
And this is why the introduction of water was so important, because it says, I called it at one point, birth with no rules.
Wow.
Because we just let it happen.
Yeah. And why is it important to look at birth from the baby's point of view?
Oh, you're talking to somebody who's...
How did you already know?
Oh my gosh, do we have 3 or 4 hours?
We have 5 more hours, yes.
Yeah. I give a list of books to read for pregnant women and their partners to read, and even grandmothers to read. And there's not a single childbirth book on that list. There's breastfeeding books, but the majority of the books that I ask women to read are by people like Dr. Gabor Mate.
Yeah. Oh, yes, I know him, yes.
Dr. Daniel Siegel. And there are books about attachment. Books by Dr. Niels Bergman, who developed kangaroo mother care. And I have been quoted, I don't care how the baby comes out, I care what you do with it for the next 3 years.
Yeah.
It's so important. But I do care how the baby comes out, because everything we do in birth can either negatively or positively affect the actual fundamental brain development of this new human being.
Yeah.
And so if we want a healthy society, we have to change the way we welcome babies into the world. And I wrote that statement that we must change the way we welcome babies into the world. I wrote that down in one of my journals when I was 13 years old.
Oh, wow.
1965. So that tells you how old I am.
So, but why? Why did you have that feeling to write that down?
My mother, I was the baby for 13 years, and then my mother had a menopause baby. She didn't think she was fertile, and so I was so embarrassed when I realized that my parents still had sex at age 40. Oh my God. Yeah. My mother was 41, and she got pregnant, and I wasn't allowed into the hospital because I was only 13. And so a friend of our family was the nurse anesthetist for my mother's birth, and she came out of the hospital. It was a small community hospital. She came out, and she brought this milk crate, and she put it down in front of a window, and she said, if you climb up on here, you can watch your mother and see your baby we didn't know if it was boy or girl, the baby being born. And I watched this process, and I said, well, you can't quote what I said. You can't air that. I was like, holy shit.
Yes.
We have to change the way we welcome babies into the world. And nursing was not my first choice. I wanted to get away from it, but my grandmother, my maternal grandmother, was a nurse and a midwife, and I couldn't walk down the street holding her hand without somebody stopping and saying, "Oh, Stella, look at my boy Johnny. You delivered him." Walk 3 more blocks. "Oh, Stella, look at my daughter Jane. You delivered her." And so it was. I knew how babies came out before they let me know how babies got in.
Yeah.
and it was, but then, that was, my grandmother started practicing in the 1920s. And so now fast forward to 1965, and we've got this, every baby's born in the hospital, there's no more home birth. And in her generation, all the babies were born at home.
Yeah.
And you only went into the hospital if you were sick and pregnant, instead of healthy and pregnant. And so she came to me in a dream after she passed away, and she said, "God needs you. God needs you to be a nurse. The little ones need you." And I said, who argues with their dead grandmother?
No choice.
Yeah, I swear she was sitting right beside me.
Wow.
And I entered nursing school the next week, basically. Yeah. I signed up, paid my fees.
Sure. And Barbara, you've influenced a lot of people all over the world. I saw 25,000 people that you've trained already?
No, 35,000.
35.
In
Wow.
83 countries.
Amazing.
And yes, I'm getting older, and I think about retiring. I told my family that I would retire at 80, and that's only 6 years away. But I seriously doubt I'll keep my word.
Yeah.
So yes, my son wants me to spend more time with my grandchildren, and
of course, yeah.
They get me. But I have more books to write. My last book is already 20 years old, and it's still. The day before I left on this trip, I got a royalty check from the publisher. It's still selling on Amazon.
Oh, wow.
And people buy it still. So I need to write the next
And
one.
do you know what the topic will be of the next book?
Of course. I think we all know. Go out, yes.
So this conversation started about birth from the baby's perspective.
Yes.
And the more a woman relaxes her body and mind, the easier it is to come out. Because we said earlier, what the mind thinks, the baby feels.
Yeah, yeah.
And so I've watched women birth. They don't even make one single noise.
Sure.
They don't push once. The baby just goes, they go, "Ooh," and the baby's out.
Wow.
That's it. I've watched them laugh a baby out. I've watched them sing hallelujah while the baby was born, and chant om, om over and over again. It's possible. And that's why I'm here, to just tell you it's possible.
Yeah.
It's in the realm of possibilities that, and the most important part of every birth is that immediate connection of mother and baby. Because in the womb, the baby is protected. The baby is warmed. and the baby receives nutrition and oxygen through the umbilical cord and placenta. And as soon as it comes out, the needs do not change. They remain.
No.
So no cutting of the cord, immediate connection, and the skin of her chest has regulators that increase or decrease her temperature to regulate the baby's temperature. The baby's heartbeat regulates by hearing that sound and feeling her breath. The baby regulates its heartbeat. It regulates its breath according to connection with the mother. People ask me, well, when should the baby leave the what I call the sanctuary?
Yeah.
And I said, when they leave for college. And this goes against what psychologists and psychiatrists told us in the 50s and 60s.
Yeah.
Oh, don't touch the baby. Leave it alone.
Yeah, you will spoil the baby,
You'll
right?
spoil it. You cannot spoil a baby.
Yeah.
And so everything you do to make the mother feel at ease, you're doing for the baby.
Yeah, but I want you to think, I look for, yes, the way the baby feels on the way out from the perspective, but how do you think this mother feels when she has this birth that's filled of joy and celebration and comfort and relaxation? It impacts so much how she parents for the next 2, 3, 4, 5
It's
months.
a self-fulfilling prophecy.
It is.
Because she tells a story of empowerment. She tells a story of love and affection. And if a baby, the baby needs to hear its birth story, always. And if you didn't have that, well, then make one up.
Oh, wow. Yeah.
Make one up. Correcting it. Tell the baby the truth. Because babies need to be able to differentiate. Because what happens is, as new human beings, we take on the responsibility for our mother's moods.
Yeah.
And we think, oh my gosh, I've done something wrong. Why aren't they affectionate to me? Oh, I must have caused it. Okay? So we plant these, what I call primal messages in our brains. Then we get to be 25 years old and pregnant, and those primal messages come right through. And unless we can turn them around and see that the fear that we have came from this chronic need to be enough in somebody else's life. To be enough. I'm not pretty enough. I'm not strong enough. I'm not capable enough. And that begins with separation. Niels Bergman says 0 separation, and I call it continuous attachment. Continuous attachment.
Yeah. I always tell moms, your baby's not even a baby till they're at least 3 months old.
Yeah.
The newborn state is just this continuation of caring.
It actually mitigates how our DNA gives us messages, because our DNA is shaped by interactions with the environment. That's called epigenetics. And so that's another book that Gabor Mate talks about that. But Dr. David Chamberlain of blessed memory, he wrote 2 books. First one was Babies Remember Birth. Babies Remember Birth. Okay, I've seen it in adults. You don't have a verbal memory of being born, but you have an intrinsic memory. Your limbic system remembers, your endocrine system remembers. Do you know that it actually takes 45 days for the drugs that are in an epidural to leave the baby's body?
Oh, wow.
45 days. And so that baby is fussy and often can't nurse as well because its brain has fentanyl and bupivacaine. Fentanyl is derived from heroin. Bupivacaine is derived from cocaine.
Oh, wow.
And the mother is injected, but the doctors will tell, oh, it's perfectly safe. And so they blame the fussiness of the baby on the formula that they're giving or whatever. It could very well be the actual drugs that the mother took. And I don't want women to have to deal with horrible pain, but there's other ways to do that we've talked about.
Yeah. Thank you, Barbara. It's really interesting to see how the birth of the outlook from the baby side and how that influence not only us but also society, right? We just had that very interesting talk, but I think we need to come back to that. Dr. Agha, I've got the next question for you. Is there any evidence that show that when a baby is born and the environment is calm and it's a gentle birth, that the outcomes are any different?
All right, so there's no specific kind of evidence around that, but there's growing evidence about similar things, and it's about the outcome of the baby resulting from not necessarily medical or organic problems. So there was a word mentioned by Barbara as the epigenetics.
Yes.
So epigenetics is the programming of the genes. So just if you consider like the hardware, it's already fixed there, but then how these are expressed, how they are interacting to get the final outcome, that can be different and modulated and can be manipulated or whatever. So that's quite related to the entire lifestyle of the person, nutrition, the amount of stress and how to deal with the stress, and all these aspects that not necessarily we can touch them and we measure them, but they will influence the development of that baby.
Yeah.
Right? And later on we'll see that appearing in the shape of either behavior, weight gain, and then autoimmune conditions, allergies, and then later on chronic diseases like heart problems or asthma or admissions to hospital, all these things, the chronic conditions that can appear later on. Then we may forget how these came into and affected that person, but the roots of all these things that started there in pregnancy or delivery. They were implanted in the genes in a way, on the programming of that body, made that body coping less with the challenges or stresses of life, ending up with these conditions. So yes, all these can play a role. Our bodies are much more complex than what we feel and what we got so far and what we know about it. And there are many elements and factors still we cannot measure in the lab, but they are playing a critical role in our bodies. And we keep discovering all these things. And the more we connect things and relate things to each other, then we will know more about ourselves and our bodies.
One of the first studies on the effect of epigenetics, and before epigenetics was even a word, was a doctor in the UK was looking at heart disease in older adults, and these were all people who were born during World War II.
Yes.
When there was rationing and some famine. And he went back and pulled records of the growth and development of those babies that are now adults with heart disease. And he saw a direct relationship between the women who were pregnant at that time on rations and not receiving enough protein and gave birth to underweight babies. They were the ones that had heart disease.
Yeah.
And so that relationship, and one of the big relationships that we're just now discussing is the microbiome.
100%.
And being born vaginally is an advantage for every human being because you're exposed to the mother's, it's the delivery system of bacteria that is beneficial for this new human being. It has to pick it up somehow.
Yeah.
And so it picks it up coming through the vagina. And on 3 days postpartum, if you do a swab of the baby's mouth and a swab of the mother's vagina, the bacteria is exactly the same in number of kinds
Yes.
and in amount of kinds. They measure exactly the same. And the breast milk then, the colostrum, the first milk, we call it liquid gold because it's very thick, it's very dense, and it's not very plentiful. And we're just finding out that the oligosaccharides, there's over 200 of them in the colostrum and in breast milk. Those oligosaccharides do not feed the baby. They feed the bacteria.
Yes.
And the bacteria then grow from the development of that relationship. And by the time the breast milk actually comes in, it's created a wonderful kombucha between the colostrum and the bacteria, so that by the time that the breast milk does come in, the baby's able to digest the proteins that are in the breast milk, and the bifidobacteria can proliferate and eliminate any toxic bacteria, take out. They're like the protection against infection. And so the breast milk is absolutely necessary, and human beings are dependent on that for brain growth, for all those situations that you were talking about, for later on in life, that there's less asthma. And how do we see the difference? We've investigated babies that don't get that, who are born by cesarean. And so this is a current, like 2026 is going to be the year that we're giving doctors the research that says, go for vaginal birth because you're going to have a healthier individual, and don't be so quick on the trigger to cut and take a baby by cesarean because of these detrimental effects of not going through the vagina. So it's...
And Barbara, do you know any research on seeding? Taking a vaginal swab and putting it on the mouth of the baby? Is that enough?
Well, I tell every woman who's had a cesarean and prepare her prior to birth. Like, the first thing you do is get the baby in your sanctuary as quickly as possible.
Yeah.
It might not be possible if this was a true emergency cesarean birth and the baby has to go to specialized baby care. But as soon as you receive the baby, make sure baby goes onto your chest. And I have been known to say, put your fingers inside your vagina and then let the baby suck on them. You know, there's other ways to deliver that bacteria. And so there have been experiments of putting gauze inside the vagina, taking it out, putting it in a sterile jar, and then as soon as the baby's out of the womb in a cesarean birth, you can lay the gauze on the baby's skin and face and inoculate the baby that way. So there's different ways to do it, but wearing the baby constantly also gives that skin-to-skin contact that's necessary to deliver the environmental bacteria that's beneficial.
Yes. I think I looked at research at one point, and unfortunately some of the research actually was a little bit disappointing to say that the seeding doesn't always help. It's not enough, to inoculate the infant. So,
well, if we know what the consequences are to missing the seeding, then we can make up some of that difference by feeding the baby, by breastfeeding an extended period of maybe 2 or 3 years instead of just 6 months. So there's lots of things that we can do to enhance the health of our society.
And To come back to you, CARIDAD, if I have a question for you on fear and the moms and how you relate it to their families, how do you support the family, not only the mom, say dad is involved, when you need to support them through the birthing process as a
Let's
doula?
ask Dr. Agha, how do I support the moms through the fear?
In a fearful way.
In many fun ways. So first we do the education beforehand. So we have these conversations. I always say, what's your biggest fear? And for some reason, lately, it's always been, it's the tearing, it's the tearing, it's the tearing. And they're so hyper-focused on this. I'm like, then write it out. Write out a story where you tear the most impossible, like from the front to the back. Write it out. What happens next? I'm taken care of. The doctor came in. He stitched me up. Did local anesthesia. I feel better about it. And then I'm like, were you able to handle that? Yes. Then why are we scared? So we work through it. We talk about it, and we continue to talk about it until they feel better about it. So we have these conversations beforehand. We do the education, obviously. We remind them that birth is a biological function. It's not a medical emergency. Okay. Maybe this fear should be talked to the medical field more than to the parents, but we do have that conversation as well. We do a lot of physical support in the birth, but we show the dad how he can support her. It's always offering those solutions and not asking a million questions and not bringing his fears into the space. And I ask him, how do you need to be supported so that you can support her? Because I'm never there to replace a partner. That's not what I do. I hold the sacred container for all of it. For the dad, for the mom, for the extended family. So we've had children at births. So like the siblings can be there if they need to. So my job is to hold that container for everybody. Okay.
We remind fathers that they need to put on their oxygen mask first.
Yeah.
Because I'll walk into a room and I pull the dad aside and say, are you drinking? When was the last time you went to the bathroom? Are you hungry? I'll fix food. I'll order food for a dad. You know, let's say the labor's been 12 hours and he hasn't left her side. Yeah, I'll make him leave the room for a little bit and take a break. And he doesn't want to, and that's okay. But put on your oxygen mask first, because when we get to the postpartum, he needs to be there. And postpartum works because the mother has the baby, and we do everything to support the mother to pay attention to the baby. And I tell dads, okay, practice now feeding her, spoon by spoon, because she's going to have her hands full. Just give her a spoon, you know, because they have to get that intimate with each other, and they really appreciate doing that in classes as well.
Men especially, they love blueprints and manuals and A to Z, and we call them, he was laughing because the other day he's like, she gave me a cheat sheet. I love it. These are the words I can speak in the space. That's it. I can't say anything else.
The first sentence or the first objective on my cheat sheet, it's like 50 things how to support your partner. Or dads, if she thinks she's in labor, cancel all the rest of your activities for that day. Simple.
Yeah.
But you'd be surprised how many, oh yeah, I'll have to call into work.
Yeah.
So to go back to the question, so by showing the father what his support's going to look like and what the process is going to look like, then he can in turn reduce his fear around the unknown. And then he can reduce her fear because she's feeding off of him. He's the closest bond that she has. The
biggest fear, as I do classes with parents, the biggest fear for fathers is to lose their partner or the baby. That's always the biggest fear. I'm going to lose and okay, remember those primal messages? The primal message is, I'm not worthy enough, or I'm afraid of being abandoned. And it comes out in different ways. So our behaviors are often guided by those statements that we make to ourselves in our brain. And so it's helpful to write it out, to put it down and understand that we can change how we think. and it makes a difference.
That's what I'm saying. It's not just write out the fear, but live through it.
Yeah.
Just live it. Write it out like you're living it. And then it's,
Well,
it's intense work. I do that with myself, with other things. Like, what happens if we move here and this happens? Well, then write it out. Oh, okay, I can handle that. That's
Yeah.
fine. There's nothing to fear anymore.
No.
Something you embrace and you surrender now.
Yeah, it's like taking a trip, but I also like to rehearse positive things. And so I ask my clients to listen to audio tapes, to picture themselves giving birth, to picture themselves holding the baby postpartum, to picture themselves, because we tend to rehearse what we're afraid of over and over and over.
Yeah.
And that's called anxiety.
Or if you're like me, try not to think about it at all.
We don't avoid it.
An avoidant here.
Because we avoid and then we give our power over.
But exactly. Because I can remember the day before, each day I was so afraid. And then I just thought, okay, I'm not going to think about it today. I will think about it tomorrow. So, but that is not empowering.
No.
It's
Discussing it
exactly.
doesn't necessarily make it worse.
Yeah.
A lot of people think, oh, if I talk about my fears, they're just going to escalate. No, but ignoring it doesn't make it go away.
No.
And this is why also I make sure that if a couple wants to work with me, that dad has to be there.
Yeah.
Because if he's not working on his fear, he's the first one to give over her power and to convince her to give it over because he's terrified. So
Well,
I don't work with couples unless they're both there and he's doing the work as well.
Even female doctors tend to be a bit misogynistic in the sense that I'm the captain of the ship and you're going to do what I say.
Yeah.
And I've seen this happen many times where a doctor will come in and take the father out of the room and say, you don't want to see your wife die, do you?
Yep.
Oh,
Yeah.
that happens all the time. You don't want to see your baby die, do you? They pull the death card.
Yeah.
This happened just months ago. I had a couple fly in from another country in Africa, and he's a politician, and this is her fourth baby. She had 3 vaginal births. A doctor that wasn't her doctor, because her doctor was on a flight somewhere else, walked in, looked at him, didn't look at her, didn't acknowledge her, didn't acknowledge me, didn't acknowledge anyone, and said to him, we should probably go for the C-section. I don't want your baby to die, do you? And he was just looked at me, looked at everybody. He's like, no, let's go. And he didn't even ask her. He said, let's just do that.
Yeah.
This was a 4th child. She had already delivered 3 times vaginally before. And I'm just sitting there like, what is happening? What is happening? This just happened recently. And I was just in shock. This woman never spoke to me again, obviously. But it was just, I don't know. Like, it's insane. How do we react to that in that moment? People are like, so how do you react in that moment, Carrie, as a support? I don't know. If he's not letting anybody else listen, what am I supposed to do?
Yeah. That's a whole nother topic.
That's a whole other podcast.
Yeah. Where does your support of couples begin and end
Yep.
in a hospital environment where there are protocols and rules that we talked about earlier?
Yeah.
And do the protocols and rules have an overarching effect on the decision making of this woman? And does she still have the right to informed consent, meaning that if I'm the midwife or the doctor, I walk into the room and I say, I would like to do this because,
Yeah.
and here's the consequences. If I do this, here's what I would like to happen, but here's the risks. This also might happen because of it. And nobody today gets true informed consent. And so a doula comes in and she's gone over all these different procedures and she cannot ask the doctor about it because it's not her job, okay? But if she stays silent, is she violating the woman's trust? It's a bit
tricky, yeah.
It's a cognitive dissonance because you know that what the doctor is suggesting is going to bring harm, okay? Like a cesarean for a perfectly normal labor with no complications showing for a fourth baby is just malpractice. It's not good. But if she says something, then the hospital will say, well, don't ever come back here.
And they did, and they have.
Yeah.
But it's okay, yeah. It's the work, right? But we continue to do the work because it's important. It's important how the moms feel. And you were talking about how this mother feels in her birth. It doesn't matter if she delivers in the water, on a bed, in a C-section, on a table, in an emergency, in a non-emergency. How she feels is the only thing she's going to remember 50, 60 years from now.
Yeah.
None of the details are going to matter. None of it. A doctor coming in and making her feel safe, a doctor coming in and bringing her peace into the moment, that's what she's going to remember.
100%,
And there's been
yeah.
studies where women that have dementia, have Alzheimer's, and they were asked about their birth stories. They have no details. They don't remember anything. They barely remember the child's name, but they remember Nurse Susie or Nurse Sarah or her doctor that came in and said, you're doing amazing, you look beautiful today, you're safe, you're okay. They remember that, and that's truly what's going to carry them.
The most important thing that you can say to any woman in labor is you are safe. Because your brain has two jobs. First job is to keep you alive through that autonomic nervous system. And the second job is to move you from pain to pleasure as quickly as possible.
Yeah.
And so every 3 seconds, our brain does an internal and external examination, it's called neuroception, of the environment, internally, externally. And so the chemicals that we release, the hormones that we release, are based on what we discover in that 3-second scan.
Yeah.
And we're constantly scanning, we're scanning. Am I safe? Am I safe? Am I safe? And so our very first discussion was about false evidence appearing real. So we start thinking, well, what does the doctor think? And we should just be focusing on that energy that's moving through the body and putting hands on belly and telling the baby, I'm safe, you're safe.
Yeah. How beautiful is that?
Yeah.
You know?
And it happens in transition every time. And the first thing I do is put my hand on their heart. I'm like, focus on my hand, take a deep breath in. I'm safe, repeat after me. They say, I'm safe, I'm protected, I'm blessed. And then they go, now we're safe to the baby, we're safe. And then they both connect in that moment. And you can see the shift. The shift is immediate. Or if he needs to come in, for example, and do an emergency situation, he sees that my hand always goes on the heart. I'm like, look at me, don't look at him. Focus on me. Let's talk to your baby. We're safe, we're okay. We trust what these hands are doing now because we did the homework before. We found the person that you can trust that's going to protect your space. So now you don't come in with your shields and your swords. You come in with a place of peace, understanding that everybody is there to protect you. And from the second you walk in, you go, I'm okay.
Yes.
Whatever happens today, I'm okay. And then if you trust that, even if something shifts and then there's an emergency or something, he's going to come in, she's going to feel okay. She's going to feel safe. She's going to look at him. She's going to take a deep breath. I'm safe. I'm okay. We're okay. And then there's never any of that stress. And the babies are born and the babies are fine because they felt safe in the entire process.